Let's discuss experimental studies. Experimental studies are interventional studies in which we do certain manipulation, certain intervention. These studies are done after observational studies. They give an idea of exact cause of the disease. Like man has performed experiment in the past. It was known that plague was an infectious disease, but experiments prove that it is due to deficiency of vitamin B3. Experiments started on animals like mice, rats, and then they are shifted to human beings. Trial of certain drugs and certain vaccines are initially carried on animals, then on human beings, like trial of coronavirus vaccine, dengue virus vaccine, malaria vaccine are being done on human beings. We will discuss this session according to following learning objectives. We will discuss the definition of experimental studies, then, what are various types of experimental studies like randomized controlled trial, non randomized controlled trial? Then, we will discuss uses of these studies, and then, what is the application of these studies? What is blinding? We will discuss blinding, what are various types of blinding, and in the end, we will summarize the session. So, let's start with definition of experimental studies. They are interventional studies. Intervention is being done. They are experiments. We perform certain experiments. We perform experiments on human beings and animals. These interventions give an idea of exact cause. So, what are randomized controlled trial? Initially, we discussed that there are two types of experimental studies: randomized controlled trial and non-randomized controlled trial. What is randomized controlled trial? When participants are divided into two groups, study group and placebo group, on the basis of randomization. This is called randomized controlled trial. So we can define that when participants, those who are being included in the study, are divided into two groups. Which groups? Study group and placebo groups. What is study group and what is placebo group? Study group is group in which actual intervention is being done, which is given the actual medicine, which is given the actual vaccine. And placebo. Placebo means dummy drug. This is a psychological treatment. We compare both the groups on the basis of randomization. What is randomization? Randomization is done to eliminate bias. Both the groups, or all the participants, have equal chance of being selected in study group and placebo group. Randomization is done on the basis of random numbers. We allot random numbers, then select the participants. All have equal chance. Some are selected in study group, some are selected in placebo group. This is done to reduce bias. This is done to reduce error. And why randomized controlled trial are called randomized controlled trials? So we have already discussed randomization is done. What is controlled? Independent variable. What is independent variable? The variable which is in our control. We control the independent variable. We manipulate. We control the dose of drug. Like we are doing a trial of beta blockers. Dose of drug is in our control. We can give 50 milligram. We can give 25 milligram. This is independent variable which is in the control of researcher. Fact is dependent variable. We decide the dose of drug according to our manipulation, according to our intervention. Like we say that dose of ciprofloxacin is 500 milligram BD for 7 or 10 days in typhoid fever. How we decided? We decided on the basis of randomized controlled trial. We increase the dose gradually and then we reach a certain limit, a therapeutic dose. That's why this is called randomized controlled trial. Randomization is done. Independent variable is in our control and this is an experiment. So, what is framework? What is framework or what are various steps of randomized controlled trial? There are certain steps which are required to conduct this trial. Number one, we have to draw a protocol. What is drawing a protocol? We have to decide our objectives. We have to decide our budget. We have to decide time frame. We have to decide how many participants are required. What is reference population? How many time will be taken? What is exact cause of the studies? What are the benefits? So this is drawing a protocol, or we have to draw a protocol before the conduction of randomized controlled trial. Then, after drawing the protocol, we have to select a reference population. What is reference population? The population from which sample will be taken. We have to take a sample. We can't include the whole population in the study. So we have to decide from which population we have to take the sample, because results are being generalized on this population. Or when we make assessment, we will say that this result will be applied on this population. So we will select reference population. And after selection of reference population, we will select experimental population. What is experimental population? The population on which manipulation is done or intervention is being done. We will do intervention, manipulation on this population, but how it will be selected? It will be selected on the basis of certain criteria. We select experimental population from reference population by drawing a criteria. What is this criteria? It is called inclusion criteria and exclusion criteria. What is meant by inclusion criteria? Inclusion criteria means those participants which are required to be added in the study, and exclusion criteria, those who are not added. Like, we are doing a study on the effect of iron supplements on anemia in children. We will include children. We will exclude elder ones. Or we are doing a study to see the effects of anti-cancerous drugs. So we know that they are common in elders. Or we will see the effect of chemotherapy on lung cancer. We all know that lung cancer is common in elder population. So we will include elder population. We will exclude children. This is inclusion and exclusion criteria. And we have to adopt a certain sampling technique. We will select population on the basis of sampling technique. It's a common question. Which sampling technique is used in randomized controlled trial? Answer will be purposive sampling. Why purposive sampling? Because we have predetermined idea what we want to do in the study. So we will do purposive sampling or non-probability sampling in randomized controlled trial. After doing this, we'll select experimental population. Experimental population should be from reference population and it must be true representative. Then we will divide this population into two groups. Which groups? Number one, study group and placebo group. We'll do intervention on study group. We'll give placebo dummy drug to other group to see the comparison. But how this population is subdivided into two groups? We'll do randomization. This population is divided into two groups on the basis of randomization. What is randomization? We will do a random number tables and then we will select whole experimental population has the equal chance, but after randomization some will be selected in study group and some will be selected in placebo group. Like, we have selected experimental population of 200 individuals and we will subdivide them 100 in study group, 100 in placebo group on the basis of randomization. After doing randomization, we will do intervention. Or we will intervene, or we will do manipulation. We'll give certain drugs, certain vaccines to these, and then we will do follow-up. Why we will do follow-up? We want to see the effects of drugs. Some people may get adverse effects, so we have to do follow-up after some period of time. Follow-up is required, observation is required after intervention. Then, After the follow-up, we will do assessment. What is the assessment? We will see whether our trial is successful or not, whether we got positive results or negative. So assessment can be positive or negative. If people get adverse effects, our assessment will be negative. If they get some advantage, our assessment will be positive. This is framework of randomized controlled trial. You start from drawing a protocol, you select a population, you select a reference population, you select a study or experimental population, you do randomization, and you do manipulation. After doing manipulation, you will do follow-up and you will do assessment. What are various types of randomized controlled trial? It has 6 types. Number 1, clinical trial. Then, preventive trial. We can also do trial of etiological agent. We can also perform restricted trial. There are cessation trials. And there are evaluation trials. These are various types of randomized controlled trial. Let's discuss them one by one. So we'll start from clinical trial. What is clinical trial? Trial of drugs, trial of medicine, in which we see therapeutic effects of drugs. Like, we'll do trial of beta blockers, like atenolol. Atenolol is a beta blocker which is used for treatment of hypertension. It is used for treatment of tachycardia. We know all this after intervention, after clinical trial. So we can summarize that if we experiment on a drug, randomized controlled trial conducted on a drug to see its therapeutic uses, this is clinical trial. Example is trial of beta blockers, or we can say that trial of atenolol. There are other examples as well. Trial of fluoroquinolones, trials of macrolides, trial of antifungal drugs, trial of antihelminthics. We know the dose after clinical trials. Then we'll discuss preventive trials. What is preventive trial? Preventive trial is done on vaccines. It is for prevention. Prevention of disease. Prevention is done to control the disease. It is a trial of vaccines like measles vaccine, coronavirus vaccine. These are all preventive trials. We have done trials on measles vaccine, dengue virus vaccine, malaria vaccine. After trial, we have found that dengue virus vaccine is not successful. It has adverse effects. But after trial, we have found that vaccine of malaria has achieved success. So we can also write malaria. We are giving coronavirus vaccine to the population. We are giving BCG vaccine or vaccine for tuberculosis to the population. All these vaccines are given trials. These are examples of preventive trials. We can say that trials done for prevention, trials done on certain vaccines, they are preventive trials. Then trials of etiological agents. What are these trials? We want to see etiology of disease. They are done to see etiology. As we know that retrolental fibroplasia causes blindness. What it causes? Blindness in premature children, premature babies. How it causes blindness? If excessive oxygen is given to premature babies, and then retrolental fibroplasia causes blindness. So we can say that excess oxygen inhalation. A study was conducted. Premature children were divided into study group and control group. Control group was given intermittent oxygen, and it was seen that child who received any sort of oxygen developed blindness. So this is exact etiology of retrolental fibroplasia. Then, 'we can do restricted trials'. What are risk factors which cause the disease? Like, we know that ischemic heart disease has certain risk factors like smoking, high cholesterol, hypertension, diabetes. All these can cause ischemic heart disease. We can do trials on smoking, high cholesterol patients, on hypertensives, on diabetics to see whether they are major risk factors of ischemic heart disease or not. And studies have proved that all these are major risk factors of ischemic heart disease. So these may be helpful in planning. We do plan that if people do cessation smoking, incidence of ischemic heart disease is reduced. By controlling cholesterol levels, it is reduced. By controlling hypertension, it is reduced. By controlling blood sugar level, it can be reduced. So these trials are helpful in preventive measures, helpful in intervention, or we can say that risk factor trials can be helpful in implementation or in further interventions. Then there are cessation trials. We can give example of smoking. People who quit smoking, people who quit smoking can have lesser incidence of ischemic heart disease or lung cancer. So, by cessation of smoking, ischemic heart disease and lung cancer, their chances or incidence is reduced. And there are evaluation trials. Why evaluation trials are done? These trials are done after certain planning or to see our plan was successful or not. Like we have implemented DOTS to control tuberculosis. After implementation of DOTS, we will do a trial, we'll do randomized controlled trial and assess whether this technique is successful or not. Our coronavirus control program. We have implemented a program to control coronavirus. In that, we'll see whether our program was successful or not. For example, world is right now going for vaccination. After massive vaccination, it is assessed that vaccination is a successful procedure to reduce the mortality and morbidity due to coronavirus vaccine. Or we will see our chronic disease control program. There are certain programs which are meant to control chronic diseases. We will see their efficacy by doing a trial. So these are various types of randomized control trial. Things to remember. We have discussed clinical trial. We have discussed preventive trial. We have discussed trial for etiological agent. We have discussed risk factor trial. We have also discussed cessation trial. We have also discussed evaluation trial. You have to remember, you can say that trials of beta blockers is clinical trial. Trial for vaccines is preventive trial. Etiological agent, retrolental fibroplasia. Trial for risk factor trial. Ischemic heart disease risk factor trial. Sedation trial, you can remember smoking. And then evaluation trial, you can remember DOTS. So these were the various types of randomized controlled trial. There are two methods which are used to conduct a randomized controlled trial, crossover method and parallel method. What is crossover study? A crossover study is a study in which we switch the groups. We know that we have taken two groups, study group and placebo group. After doing intervention and manipulation, we will switch study group to placebo group and placebo group to study group. But we'll take some gap. Like we conduct a trial. Participants were divided into study group and placebo group. After doing manipulation intervention, we'll take a break. After some time, we'll switch both the groups. What will be the framework? This is study group. Initially, intervention is being done. This is placebo group. We observe them for a certain time period. Then we take some break to eliminate their effects. And after some time, we'll switch them. Study group becomes placebo group, and placebo group becomes study group. This is crossover trial. So we will shift them. Like we say that this is group number one, this is group number two. After some time, this will become group number one, and this will become group number two. So both the groups have equal chance of intervention. Our intervention is being done on both the groups. This is crossover trial. This is ideal trial. But the problem with this is that it is time taking. It takes double time. It is expensive. So we can do parallel trial, a parallel study. There are two groups. We already know this, study and placebo. We do interventions. We'll do follow up. We'll do assessment on both the groups. We study them parallel. They are not switched over. This is parallel study. This is comparatively easy. Randomized controlled trials are used when only a single group is studied. Intervention is done on a single group. There is no placebo group or there is no comparison group. Sometimes it is not possible for researchers to add two groups or to take two groups because it may take longer duration of time. So we do non-randomized controlled trial. As the name indicates, there is no randomization. Only one group is selected and intervention is done. Then follow-up is done. Then we make the assessment. So we can say that in non-randomized controlled trial, there is no comparison group. There is just study group, or we can say that there is no placebo group. Experiment is done on a single group. And there are three types of non-randomized controlled trial: uncontrolled trial, natural experiments, and before and after comparison studies. What is uncontrolled trial? When study or intervention is done on a single group for diagnosis. In natural experiment, we learn from nature, we learn from incidents, we learn from disasters, we learn from accidents. Before and after comparison study, we do a legislation, we do an intervention and see whether this intervention has improved the health status of a community or not, whether it has decreased the burden of disease or not. Now we'll discuss them one by one. Uncontrolled uncontrolled studies, as the name indicates, that there is no control group. There is only one group. We take one group, we'll do intervention, we'll do follow up, and in the end, we'll make the assessment. Like we already know from observational studies that pap smear is diagnostic and screening test for cervical cancer. So we'll do pap smear. We take a study population from reference population. We know that cervical cancer is common in female of low socioeconomic status. So we will consider low socioeconomic status. And then it is common in females who have multiple sexual partners. So we will consider multiple partners. Then it is common in female of middle age. So we will select the study population according to this criteria. Then we'll do intervention. We'll do screening and diagnostic test. We'll do follow-up and make assessment. What is assessment? Whether this test is useful in reducing the burden or not. Why this test is useful, how this test is useful. Because we test the female, we do screening, we diagnose them early. When we diagnose the disease at earlier stages, we'll do intervention, we'll do the treatment. And when we do treatment at initial stage, prognosis is better, mortality is reduced. So there are natural experiments. What are natural experiments? Nature, sometimes nature tells us how to do an intervention, like in case of disaster. After disaster, we do certain interventions, like after earthquake or after flood. We search, we rescue the population, we give them shelter, we provide them food and nutrition. So these are natural experiments. Before and after comparison trials, before and after, we do an intervention. Initially, we will see what was happening before the initiation of some legislation or intervention. Those who are not using seat belts are more prone to accidents. Or injuries are severe in those who are not using seat belts. So we'll do an intervention of seat belts. What is intervention? Seat belts. And we'll see after this intervention, severity of injuries is reduced or not. If the severity of injuries is reduced after this intervention, we can say that this intervention is successful. Or motorcyclists don't use helmet. We have observed that severity of injury or head injury is more common in those who are not using helmets. So we'll do a legislation of helmets, and we will see whether after this legislation or intervention severity of injury is reduced or not. So now we'll discuss the uses. What are various uses of experimental studies? Number one, they can tell the cause. After experiment, we know the cause. What is the actual cause of disease? They can tell the burden of disease. They can guide us about interventions. Because experimental studies are based on interventions. What is application? These studies are applied in pharmaceutical industry. How in pharmaceutical industry? When various drugs are launched, they are being tested. Their efficacy is tested. Their dose is tested. Whether they are effective, what is their therapeutic dose? They are tested and randomized controlled trials are done. They are helpful in diagnosis, like a non-randomized controlled trial. Ultimately, they are applied in planning. We can do plan accordingly. We can do management accordingly. So they are helpful in management also. Blinding. We have seen that bias is present in various studies. Bias is present in randomized controlled trial. We already done randomization to reduce the bias. But bias is still present, so we have to do blinding. What is blinding? A process in which we try to reduce the bias by blinding observer, participants, or analysts. Three types of people are involved in a research studies. Number one, participants, on which experiment is being done. Then observers, who observe the participants. Analysts, who analyze the data. Bias may arise due to participant, bias may arise due to observer, bias may arise due to analyst. Like, if the participant know that they are in placebo group, they will not give actual answers. They will not give exact data. And if observer now who are placebo and who are study group, they will not focus on placebo group. Bias can arise. And if data analysts know about the groups, about placebo, about study group, bias may arise. So we have to reduce this bias by blinding. There are three types of blinding: single blinding, double blinding, triple blinding. As the name indicates, in single blinding, we blind only one group, we blind only participants. So, participants don't know they are in placebo group or in study group. When both participants and observer are blinded, this is called double blinding. Both of them don't know which group is study, which group is placebo. And when we blind, analyst also with them, with participant and observer, this is called triple blinding. Single blinded trial is easy to carry out. Double blinded trial takes time. Triple blinded trial also takes time. So most of the times there is double blinding. It depends on scenario of the study, but blinding is done. Blinding should be done to reduce the bias, to reduce the error. Now we can say that there is participant, observer, analyst. Only participant is blinded, single blinding. When both participant and observer are blinded, double blinded. When all of them are blinded, this is triple blinding. So this is a common university question. What is blinding? What are various blinding techniques? So you must remember single blinding, double blinding, and triple blinding. You can remember by participant on which study is carried out, observer who observes, analyst who analyze the data. So they are blinded step by step. In single blinded, you blind the participant. Double blinding, you add observer. In triple blinding, you add analyst. So in the end, we'll summarize this session. We discussed about experimental studies. So you must know that there are two types of experimental studies: randomized controlled trial and non-randomized controlled trial. In randomized controlled trial, two groups are involved. In non-randomized controlled trial, there is only one group. So there is no comparison group. Then, randomized controlled trial has various steps. Like you have to set a protocol. You must remember these steps. Protocol. What are various objectives? How much time will be taken? You must consider budget. Then you select a reference population. You select sample or experimental population from this reference population. Then you do randomization. This is heart of experimental study. Randomization reduces bias. You do randomization and divide the study participant into two groups, study group and placebo group. Study group receives intervention, while placebo group don't receive any intervention. Placebo means dummy. Then you will do intervention or manipulation. Then you will do follow-up, and in the end, you will do assessment. These are the various steps of randomized controlled trial. So you must remember them, like study protocol, then reference population, then experimental population, then randomization. Then you will divide this population into two groups, study group and placebo group. Then you will do intervention. Intervention needs follow-up. After follow-up, you will do assessment. This question is asked in university. Write down various steps of randomized controlled trial. Then we have discussed various types of randomized controlled trial, various methods of randomized controlled trial. We discussed that there are clinical trials, there are preventive trials, risk-factor trials, etiological trials, evaluation trials, cessation trials. These are various types of randomized controlled trial. We adopt two methods to carry out randomized controlled trial: parallel study and crossover study. This is asked in university question. What are various methods? So you must remember parallel and crossover. We already discussed in crossover study we do switching. We switch the groups. We change the placebo group to study group and study group to placebo group. Then we discussed non-randomized controlled trial. Non-randomized controlled trial. You just take one group. You must remember non-randomized controlled trial. There is only one group. No randomization. So element of bias may be higher in non-randomized controlled trial. Then we discuss various types of non-randomized controlled trial, uncontrolled trial. We have discussed the example of pap smear, natural accidents, natural experiments, disasters. Then we discuss before and after comparison trial. We do a legislation and compare what was happening before that legislation and what is happening after that legislation. If burden of disease is reduced, severity of injuries is reduced, then our intervention is going in the right direction. If it is increasing, we must need to change our intervention. Then we discussed various uses and applications. Planning and management is integral part. We do planning and management on the basis of these results. We see the therapeutic dose of various drugs on the basis of these trials. And then we discuss blinding. What is blinding? This is a common university question, a process, a procedure, which is used to reduce or to minimize bias. You reduce the bias. Number one, we reduce the bias by randomization. Number two, we can reduce the bias by blinding. You must minimize the error. We have to apply these results on whole reference population. If error arises, we can go in wrong direction. We have to do intervention. So we will minimize the error. So blinding has three techniques: single blinded trial, double blinded trial, triple blinded trial. Three groups are involved in a study. Number one, participants. Number two, observers. Number three, analysts. If we blind participants, that is single blinding. If we blind observers and participants, double blinding. If we blind all three, triple blinding. So, what is the difference between observational and experimental studies? In observational studies, we follow the nature. There is just observation, no intervention is being done. And in experimental studies, intervention is being done. We do certain intervention, we do manipulate. There is a common MCQ. Why randomized control trial is called randomized control trial? Because we do randomization. Independent variable is in our control and it's an experiment. Then why we do randomization? To reduce bias. Why we do non-randomized control trial? Because when alternate group is not available, when we know the facts from observational studies, then we do uncontrolled trial. Then we discuss blinding. That's all for the session.